Good morning. This video is about Hashimoto thyroiditis. I'm going to talk about how it evolves, how it causes hypoactive thyroid, hyperactive thyroid, dosage adjustment, and the history. So Hashimoto thyroiditis is known as a chronic lymphocytic thyroiditis as well. It's an autoimmune disorder where the immune system attacks the thyroid gland, leading to its dysfunction. It was first described in 1912 by Dr. Hakaru Hashimoto, a Japanese physician, hence the name. Over the time, it has become the most common cause of hypothyroidism in developed countries. In Hashimoto thyroiditis, the immune system produces antibodies against thyroid cells, specifically thyroid peroxidase and thyroglobulin. These antibodies cause inflammation and damage to thyroid tissue, impairing the thyroid's ability to produce sufficient thyroid hormone, that is T3 and T4. Initially, the thyroid may enlarge, may form goiter, but over time it typically shrinks and become underactive, leading to hypothyroidism. So, the most common result of Hashimoto thyroiditis is hypothyroidism. As the thyroid becomes less functional, it cannot produce enough thyroid hormones to meet body's needs, leading to symptoms of fatigue, weight gain, depression, cold intolerance, constipation, dry skin, hair, slow heart rate, swelling in the face. Sometimes people also develop hyperthyroidism in Hashimoto thyroiditis. Although Hashimoto thyroiditis usually leads to hypoactive thyroid, some patients may experience transient hyperthyroidism, a phase called hashitoxicosis. This occurs when thyroid cells are damaged and release stored thyroid hormone into bloodstream. And symptoms of hyperthyroidism include palpitation, nervousness, weight loss despite normal or increased appetite, heat intolerance, tremors, insomnia. This hyperthyroid phase usually is temporary and often resolves as the disease progresses to hypothyroidism. Dose adjustment in treatment. The primary treatment for Hashimoto thyroiditis is thyroid hormone replacement therapy, typically with levothyroxine, which is synthetic T4. The goal of therapy is to normalize thyroid hormone level, which can vary based on individual needs. Dose adjustment. Initial dose of levothyroxine depends on age, body weight, severity of hypothyroidism. A typical starting dose, usually we calculate, is 1.6 microgram per kg of body weight per day. For elderly patients or those with cardiovascular disease, a lower starting dose is usually recommended, usually 25 microgram per day up to 50 microgram per day. Regular monitoring. TSH, which is thyroid stimulating hormone, levels are monitored regularly to assess adequacy of replacement therapy. Initially, TSH levels should be checked every 2 months after starting or adjusting the dose. The dose of levothyroxine adjusted based on TSH level. The goal is to achieve TSH within the normal range, which is usually in between 0.4 to 4.0. If the TSH remains high, that means there's a hypothyroidism. The dose should be increased. Conversely, if the TSH becomes too low, suggesting overtreatment or subclinical hyperthyroidism, the dose should be reduced. Factors such as pregnancy, age, presence of other health condition, cardiovascular disease may influence the dose. For example, during pregnancy, the dose of levothyroxine may need to be increased to support both maternal and fetal needs. So, in conclusion, I'm going to say that Hashimoto thyroiditis is a lifelong autoimmune condition that primarily causes hypothyroidism. Treatment with levothyroxine helps normalize thyroid hormone levels, and dose adjustment are made based on regular monitoring of TSH levels. The most patients develop hypothyroidism. A temporary hyperthyroidism phase can occur, requiring careful monitoring and dose adjustment to prevent complication. I have several patients with Hashimoto thyroiditis who are going through this dose adjustment phase right now. So thank you for watching. I wanted to create this video for you so you can enhance your knowledge, empower yourself, and ask the right question from your doctors. Thank you for watching.